Good morning and welcome back. We're excited to hear from Diana Barrett, who is founder and survivor of SurvivorCore, Natalie Lambert, who is with the Indiana University School of Medicine, is a researcher who's going to be talking with us about citizen science, and Liza Fisher, who will share with us her story of long COVID. But before we do that, I'd like to hand it over to Natalie Lambert, who will be walking us through some of the science and background that's been able to be collected by SurvivorCore. And Natalie, can you also just give us just a little bit of background about SurvivorCore and how it got started?
Absolutely. Thanks very much for having me. So it's very nice to have everybody here. To give you some background, SurvivorCore, started out as a Facebook group. It was founded by Diana Brent in New York City, and it was initially started as a way of bringing COVID survivors together in order to both get plasma donations, sort of finding people who had COVID, and had recovered enough at home that they could then donate, and then being able to get those donations to people who had just been diagnosed with COVID and who really needed it in order to recover. This was early days in the pandemic before we even knew the best medications to treat people once they had been hospitalized. So it was started with that function, but it's grown to be so much more since then. So if you go to the SurvivorCore Facebook group, you'll see now that has well over 170,000 members. It's a Facebook group you can find by searching it, and it's a place where people can go to get really excellent information about COVID, about long COVID, which we'll talk about more in a second. It's a place for people to support each other, to learn about research studies they can participate in, and to even get links about where they can get really effective treatments like monoclonal antibodies near them. So I hope that Diane can come on later to tell you more about their journey to developing really innovative and effective models of citizen science. But to get started, I would like to present you some information from the research that I've done with SurvivorCore, collaborating together. And I'll start with a little bit of history, actually, about early on in the pandemic, what we knew, as opposed to the different types of long COVID symptoms that we were able to identify through our work. So you can go ahead and go to the next slide, please. So if we go back to very early in the pandemic.
I can hear everything's working fine. I'm just afraid to
these images may look a little bit familiar to you. So the one on the left was a screenshot from cdc.gov, where it's showing, very early on, all that we knew was that the basic symptoms that someone might have COVID-19 were symptoms like fever, cough, or shortness of breath. The screenshot on the right-hand side was just a little bit later when we had more data and realized that beyond just basic fever symptoms, there were other things that were going on. There were stomach aches, joint pain, chills, loss of sense of taste and smell. So that was sort of early on what we knew. But the research that I do involves capturing patients' experiences, and I've done that in the area of breast cancer. But as soon as the pandemic hit, I was going online to different social media platforms and looking for patients' firsthand accounts with COVID. And what became clear very early on was that these lists of symptoms did not capture all the things that COVID survivors were going through. And in fact, many people who had COVID were not recovering. So if we go to the next slide, please. So I reached out to SurvivorCore, and Diana and her team of amazing admins, administrators, PR people, staff people, did this incredible job of helping me to build a survey that was based on an initial Facebook poll where we identified these long-lasting strange symptoms that people reported having after recovering from the initial couple of weeks of COVID, but they're sort of lingering and ongoing. So we collected a list of those symptoms. We did an initial Facebook poll, and we identified that there were quite a few things like brain fog, difficulty forming or retaining memories, really terrible headaches, joint pain, back pain, nerve pain, all of these things that really the medical world was not aware of yet. So we expanded on those, created a survey, and Diana and her team promoted it on the SurvivorCore website. And you can see some screenshots of that here. And the members were so gracious with their time and so dedicated, even when they were so ill, that we were able to have over 5,100 long haulers take our survey. If you go to the next slide, please. So again, it was 5,800 who took it, but we filtered that down to people who had symptoms for 21 days or more to make sure that they were more in that long COVID stage. This is before any official definitions. We're even still working on definitions of long COVID. Most of the people who took the survey were women. At first, we thought maybe that was a bias, that there are more women online, more engaged in this type of research. But more current studies have shown that indeed, it's very possible that women are more likely to become long haulers. So here you see the different basic demographic info. So the results that you'll be seeing coming up are based on those 5,100 people. Next slide, please. And what was really fantastic about the survey is that it helped to fill a really big data gap, which was that most of the information we had about people who had COVID were from hospitalized patients. Because as soon as a patient is admitted to the hospital, we start collecting data on them that goes into an electronic health record that researchers like me can access to do their research. Well, the people who were not hospitalized, so they weren't sick enough to be hospitalized, or maybe they would typically be sick enough to be hospitalized, but the hospitals were overwhelmed at the time, were told to recover at home. And many of those people, some did not have positive PCR tests. They couldn't find a test earlier in the pandemic. Many of them were never treated by a doctor. And a lot of those people, were the ones, that's a typical story for a long hauler, is that perhaps they were not hospitalized and were trying to recover at home. We also had good coverage of age here, as you can see in that graph. Okay, next slide, please. Okay, we're going to zoom in and talk about each of these, and you can find all of these data and graphs on the SurvivorCore website. But I just want to show you that the results showed that, there were 31 of these long haul symptoms that were reported by at least a quarter of the participants, and the total number of symptoms reported was 98. So if you are someone who is advocating for a long hauler, if you're a long hauler yourself, and you meet someone else who is a long hauler and you're comparing your symptoms, you might have one or two in common, something like fatigue or cognitive problems, difficulty concentrating. But it's also possible that you could have completely different symptoms and still be long haulers. That's just the way that long COVID is, and this type of research helped to show that while there are some, health impacts and symptoms that long haulers may have in common, it can look very different for everyone, and that can make it very challenging for someone with long COVID to really explain to their doctor what they're going through, to be recognized as even having long COVID, especially if they don't have a PCR test. So we'll go to the next slide and we'll look at some of these specific symptoms. Okay, so on average, there's an average of per person of 21.4 symptoms with a range from 1 to 93. So you can see that the number of symptoms, the symptom load is quite high for any average long hauler who took our survey. The most common long-lasting symptoms, and this was lasting, remember, for at least 21 days, and for many people it lasted for, many months, up to 6 months to a year or more. So the most common one was fatigue, followed by headache, shortness of breath, difficulty concentrating, cough, changed sense of taste, diarrhea, and muscle or body aches. However, the longest lasting symptoms that were reported, and this was just a snapshot in time. So if someone, you can imagine if they took the survey within the first month of when they were sick, this could be different from someone who took the survey 6 months after first getting sick. But in general, the longest lasting symptoms was actually sort of a quality of symptoms that people with long COVID told us about, which was the fact that any of the symptoms that they had were frequently changing. So it could be that they would have a symptom like fatigue, and it might eventually come and go over time, and it would seem a little bit unpredictable. It could be that the severity of the symptom could get worse. So they might experience something like headaches, and it might be something that's, persistent, so it doesn't resolve, but it's much worse on some days than others. And that, as I'll show you in a moment, this symptom, the fact that symptoms come and go and can sort of get worse or resolve a little bit, makes it very difficult for people to work. And I think part of it is how much pain or discomfort it causes, but it also can be due to the fact that it's really hard to explain to an employer that you're feeling better one day and you're feeling worse the next. It also can be very difficult to explain that to family members who, if you have worked with patients with chronic illnesses in the past, that many family members believe that a chronic illness, it should be like a more typical illness where people should slowly get better over time. They shouldn't be getting worse, or they shouldn't be sick for a very long time. So we really have to make sure when we're advocating for long haulers that we're challenging this narrative about health, that people should be recovered after a certain period of time, because with long COVID, that's just not the nature of these symptoms at all. Other symptoms that lasted a very long time were this idea of inability to exercise. This can also be thought of exercise intolerance. And in fact, long haulers often report that if they do try to reintroduce exercise too early in their recovery timeline, or if they do too much physical activity, it can actually trigger or worsen many of their symptoms again. So we have to be very, very careful when it comes to recommending exercise. Okay, so you can see the other ones here. The things that are related to sort of sadness, these types of memory problems, there's a lot of discussion about the need to make sure that we don't attribute physiological symptoms as psychiatric symptoms, that we need to do assessments of both people's physical health and their mental health at the same time if they've had COVID, and to not just focus on one or the other. And I'm sure that Diana would be happy to talk more about that later. It's a very important issue for advocating for long haulers. So next slide, please. Okay, we'll go to the next slide if that's okay. Thank you. Okay, so we also asked everyone for every symptom that they reported, we asked them how much it had different impacts on their life. So we asked them how much each symptom impacted their ability to work. And so once again, the fact that symptoms come and go make it very difficult for people to return to work, and anything that impacted people's cognitive abilities or their ability to form and retain memories made it very challenging to work, as you can imagine, and also the fatigue. There's many long haulers who said that as offices opened back up, they were very concerned about being able to go back to work, because when they were at home, they're able to adjust their work schedules. They're able to take mini breaks and rest, and even work. If they had more of an office job, they were able to work in bed or laying down, and that returning to the office, they wouldn't be able to do that anymore, was a big concern we've heard lately. Symptoms that caused the greatest amount of distress in terms of pain or discomfort were things like extreme pressure that people reported at the base of their head, syncope, sharp or sudden chest pain, brain pressure, headaches, persistent chest pain and pressure, and then bone pain. There's also different types of nerve pain that we're starting to learn more about that can make it very difficult for people to function and to work. This is the last point is a paper that will be coming out, we hope, in a couple of months, but we actually looked at the timing of the different symptoms for long COVID, and we find that they do seem to come in waves. So you have the initial onset of more flu-like symptoms, and then later it's followed by the neurological and more cardiovascular type symptoms that could be related to a sort of strong immune response, sort of an overreactive immune response, followed by microvascular type consequences. So you can be on the lookout from from a publication from myself and Survivor Corps and my other research team about that. Next slide, please. Okay, so this is just looking at the big picture here. We plotted two different things along with work impacts. So what we have here is we compared how long symptoms lasted, the long COVID symptoms, and we compared that to how much pain and discomfort they caused on the y-axis. And the darker the label is for the symptom, the darker the blue color, that means that the symptom made it more difficult to return to work. So if you go to the next slide, we'll zoom in on that so you can see it. Okay, so I don't know if you can read the little labels, but basically what this says is that there are some symptoms that cause a lot of pain and discomfort and distress, and a lot of these are a lot of the, like fatigue, headaches, and things like that make it very hard to work. There are others that are difficult because they last a very long time, such as fatigue, memory problems, these type of cognitive problems, so not as painful, but very long lasting. And there's others a little bit of both. And you'll see that one of the symptoms in that sort of upper right-hand circle there was people reporting drastic personality changes. And this is something that needs a lot more investigation, that having COVID can cause people to, suffer from, new types of mental health problems. And we need to understand that there's certainly a connection between the physical impacts of the virus on our bodies and any sort of, mental health or psychiatric outcomes that are happening as well. Next slide, please. Okay, so I just want to talk about one more study, and then we can hand it over to Diana and Liza. But this study, we actually did look at health records because our question was, we just want to look at these electronic health records for people who are likely long haulers and try to understand, what makes it more likely that somebody could become a long hauler. So we looked at health records for the state of California. We found people who tested positive for COVID-19, were never hospitalized, and they didn't have any pre-existing conditions that mimicked any of their long COVID symptoms. And we also looked at people who had been sick for a fairly long period of time for over 2 months. Next slide, please. And what we learned from this study is that, again, women with a normal BMI were often showing up as long haulers. But again, it's a demographic group that's more likely to be seeking care in the first place. So this also is a big indicator that we need more representative data sets in order to have models that are accurate for the entire population and not just focusing on people who can best access healthcare. But the really interesting one is the second point there, which is that being asymptomatic early on, so having no symptoms in the first 11 days, was the strongest predictor of someone becoming a long hauler. What this means is that, right now, I think a lot of us might say that, well, if someone gets sick from COVID, if they get really sick, but they're not quite hospitalized, that's someone who becomes a long hauler. In actuality, there are many people who don't even know that they have COVID, but weeks and months later are having this wide range of strange and very difficult symptoms that are likely due to COVID, and they are very likely long haulers. So this is a much bigger problem, and it's going to be something that we have to be working a lot to communicate to medical providers, the healthcare system, that there are likely many more long haulers out there than we have any idea about right now. Another important thing was that 2% of the long haulers we identified were actually pediatric patients. So those are people who are 18 years or younger. So we need to be doing a lot more research on long COVID in children because that is also very likely very much underdiagnosed. Next slide, please. Okay, and I just want to make a point that this is something that I know Diana is very passionate about studying and understanding as well. But it's the fact that there are many reports of severe neurological impacts of long COVID. And these are things that perhaps you've not heard about in the news, but you need to know about because it is happening it's happening fairly frequently in patients. So these are symptoms like feeling internal tremors, loss of muscle control, different types of neuropathic pain. So it could be tingling, weakness, heaviness, shooting pain down the arms and legs. And it's something that, because it's not always easy to measure that with a typical scan, that it can be difficult for patients to get that recognized by medical providers. But this is something that's being reported very frequently by long haulers. Next slide, please. Wanted to start to close here by talking about some of the current theories about the causes of long COVID. We know that the immune system is a huge part of this. Sometimes people talk about COVID and long COVID as an overreactive immune system. It also is being activated in very dysfunctional sort of ways, that we need better immune system regulation. That's an avenue that researchers are pursuing. There's a theory about viral persistence, the idea that the virus may actually be hanging out somewhere in the body and continuing to cause damage and dysregulations. We know that there's certainly damage being done to nerve pathways as well as the vascular system. Microclotting is a huge problem. We also know that inflammation is something that's being caused and could be one of the underlying mechanisms. And different teams are looking at different ways to try to, at least in the short term before we know more about long COVID, to try to control inflammation to give long haulers some relief. Next slide. This is the final one for me. I know this model is kind of small, but I think this is very important, particularly for people who are going to be advocating for long haulers. But in the large survey, we did ask long haulers, if they were unsatisfied with their provider while they were seeking care for long COVID. We asked them, what was the problem? What happened? And over 2,000 of the long haulers replied to this question. And doing a qualitative analysis, what we found is that there are some background conditions that result in a problem, which is that long haulers are feeling dismissed by the medical system. And some of the problems were people not having a positive COVID test, difficulty even getting appointments to be seen, the fact that doctors didn't have very much knowledge about long COVID or the range of symptoms that they're experiencing. A lot of long haulers felt like they were not getting very good quality of care. Their symptoms were ongoing. They just really felt like they're being misdiagnosed, actually, that they were not, since they were not being treated for long COVID, they were being diagnosed with some other problem. They felt that that was just not a proper diagnosis. And some of the outcomes of feeling dismissed by the medical system was that many people started to self-advocate. Whereas other patients, if they have a bad interaction with the health system around long COVID, they then believe that they cannot get care for long COVID and will stop interacting with the medical system, which is also potentially very dangerous. A lot of people walk away feeling frustrated or angry, feeling very alone. And I think this is really important thing, is that this is not feeling alone before seeing a doctor for long COVID care. This is feeling alone after seeing a doctor for long COVID care. And then, of course, suffering from these ongoing symptoms. So now I'm going to pass this on. I'm hoping that Diana Brent is on the call. I think you'd be so valuable to hear more from her about Survivor Corps and the amazing things that they're doing. So I'll turn it over to you, Diana.
Actually, welcome back, and thank you, Natalie. That was really terrific. Diana is a little delayed, so in the meantime, we're going to pass the camera over to Liza Fisher, who will be sharing her personal story. Liza?
Hi, yes. My name is Liza Fisher, and I am in Houston, Texas. I feel like I check so many of the boxes that Natalie just described. I got sick, I started being symptomatic last June of 2020. And what I thought at the time was a sinus infection, like so many people do. Young, healthy, I rarely got sick. I didn't even have a primary care at the time because it had been a while since I had really been sick. And then it was June 27th is when I woke up and I felt like I got hit by a truck. I had the elephant on my chest, fever, sensitivity to light symptoms, and I thought, wow, something's wrong. I've got to get tested. At that time is when Houston was starting to experience one of their surges, and testing was difficult. So I struggled to get tested, and I even had a friend in Dallas trying to make phone calls to try to help me get tested. So I was able to find a testing location the next day, and that first test came out negative. I continued to experience heavy respiratory symptoms, and a few days later went to multiple facilities, ended up in an ER, and by chest x-ray was diagnosed with COVID pneumonia. Although they said, if you get like this again, please call 911, because I was struggling, and they still sent me home because on the basis that I was young and healthy and I hadn't started to exhibit continuing symptoms of GI and other things. So I went home, was prepared for a bad 2 weeks, the 2 week flu that everybody had told me about, and it continued to get worse. About a week later, I made another appointment with an urgent care to check my vitals, because at that point I started to display the GI symptoms and was struggling to keep fluids in, couldn't eat, all of those fun things. The urgent care that I made the appointment at wouldn't see me because I was tested positive. That day was hellacious. I went to multiple facilities, being turned away, even returning to the original ER that diagnosed me with COVID pneumonia. And the security guard actually yelled at my friend in the parking lot and said, "Why did you bring her here? We can't see her." So we found a hospital that was taking COVID patients that had a COVID wing. And I was seen that day in a tented facility in the hospital parking lot. And based on my SATs and my positive diagnosis, was taken to an isolated wing where I waited for hours and did like your basic OSAT walk, and then on my vitals was said I wasn't sick enough to stay there. They had people waiting a couple of days for a bed. I'm in the middle of it. Days 8 through 12 are your bad days. Go home, you have a really bad flu. So they said, if you get worse, come back. I said, this is what I was told last week. I'm done. So I fit that category at that part of giving up on healthcare. And I never experienced that before. My family background is in healthcare. My mom has been a nurse for over 30 years. My dad was a respiratory therapist. They switched shifts, and I grew up in the hospital in the waiting room. It was something that was very familiar to me. So I live alone, and I went home and I tried to tough it out. I continued to experience the GI symptoms, and along the way, the neurological symptoms came. I later realized how severe they were, but at the time didn't. I started to experience the tingling, the paresthesia. I was falling. My dad had sent me a walker, and I was even falling in the walker. I was taking breathing treatments at home, doing all of the things. I started seeing a primary virtually. That continued for a couple of weeks, and then she said, "You need blood work." I can't figure out what's going on. I wasn't able to get into a facility to get the blood work because I wasn't able to test negative. This continued until July 30th, where I went to an ER based on my primary at the time had told me. And on that day, I was admitted into a COVID ICU. I stayed there for a week. I don't remember most of the first couple of days. I later realized I had like COVID ICU delirium, in which I was having COVID like hallucinations, shivers a lot. I had started to shake, which I attributed to malnourishment and dehydration, and always felt like I was leaning to the right and falling to the right inside my head. So I was already starting to not be able to walk. So they put me on the bed risk, where you aren't allowed to get out of the bed. And when you try, that alarm really stinks, I'll tell you that. But so I was still struggling. And after they stabilized me, I was sent to a rehab hospital. I was keeping a medical journal at that time and had started taking videos throughout the process based on the recommendation of my friends and posting them on Facebook. So thankfully, otherwise I wouldn't really have a good timeline of what was going on. But based on my journal, I think it was around August 11th, August 15th. And that's when I started to experience full-on body tremors at a heavily Parkinsonian type level. And there was a disconnect between my brain to my feet, and I wasn't able to walk. My feet started to scissor, my heels weren't able to touch the ground. And then it started to go from my feet up to my hands. I had trouble gripping things, I lost my reflexes. So the neurological really started to impact. I saw multiple neurologists and being seen for like a movement disorder at the time. And thankfully, I found a wonderful doctor at that rehab center who's now my primary, who just really took me under her wing. And she found the first post-COVID clinic in the state of Texas for me, and I've been under their care. And then I am now to the point where I am still utilizing the wheelchair, but am working on walking. And I even she found somebody who was able to figure out how to like implant a neuromodulation device into my spine, with the kind of concept that it would slow down the central nervous system for being in that hyper overdrive. And that was fairly successful. And I was able to calm down the tremors enough so that I could gain some muscle and work on stability and things like that. I've since been diagnosed with multiple rare disorders, mouths, POTS, things like that. They're dysautonomia. It's very common post-COVID once you enter into that world. The things that I've learned from this in regards to advocating is to not give up, because it might make things worse, and that I was in such a better position than, even though my outcome is really extreme in regards to things, but I was in a better position given my family history that my parents were in healthcare, that I knew things as far as like researching different options for treatments and medications. I had a fairly wide range of knowledge and being able to utilize language, knowing that, you know, when the hospital wanted to send me home, I was like, no, I need a PT eval because I can't walk. I knew that I could always use, you know, the term derelict of duty and asking for a charge nurse. I know that there's a little bit more and have learned even more on how to navigate the insurance system. And there's just so many different intricacies in dealing with this new post-COVID world and the mass amount of people that are entering into the system that just really needs to be recognized and handled and taken action upon. So that's a lot of what I've learned and continue to learn, especially as it's now moved me into the disability world. I have had to deal with private, short-term, long-term, and government, and I actually have been approved for SSDI and did it in a fairly quick amount of time, surprisingly. So I welcome any questions moving forward. I experienced and to continue to experience a lot as far as my entire medical journey in getting treatment that has never been done approved by insurance and getting a new illness approved by Social Security disability and getting hospital stays covered that have never been done before, all of those things. So there's a lot to be learned. And then that, I think I will turn it
ready.
over to Diana.
Thank you. Yeah, thank you so much, Liza. What an incredible story. And I love a lot of those tips in terms of what you've been able to learn, derelict of duty, et cetera. And I know that we want to get to questions, but first, Diana, welcome. And we'd love to hear a little bit more about your story and how Survivor Corps was founded.
Thank you. And thank Liza, just thank you for everything that you continue to do. You are the sort of model Survivor Corps member, not just working to help yourself, but others. And I'm actually, don't want to bury the lead, but Liza's actually co-authoring a paper with us next week on these tremors, these Parkinsonian-like tremors and vibrations that will hopefully really open up this horrible symptom for the world to see and for further study to happen. So a true citizen scientist on our hands here, and a hero really for what she has brought to the rest of the community. My name is Diana Berendt. I'm the founder of Survivor Corps. I was one of the first people in my area to get an early diagnosis of COVID in early March of 2020, when we thought that, you know, COVID was something that only affected the elderly and the immunocompromised. And here I was, you know, 45, the height of health, and I was the first one in my area to get the plague. I got it 1 degree away from a super spreader event in New York City. I had to fight to get tested, really fight hard. And I fought so hard because things hadn't shut down yet. So I was pretty convinced that I could have been patient zero for my town. And I was terrified. I did my own contact tracing on Facebook because I first was denied testing. I got media attention because of that. Did get tested positive. And the New York Post ended up giving me a daily column and video blog that I kept throughout my isolation. I had a very typical case of COVID, what's considered the mild, super mild case. Super mild meaning that I had COVID pneumonia, I had encephalitis, I had sleep regulation issues for months, I had gastro issues for months and months. I still have deep inner ear pain. That's probably the only remaining symptom. I was diagnosed with glaucoma, COVID onset glaucoma by September. Remember, I was sick in March. I didn't see my first doctor until August. And I realized that we were in this very unique situation where we had completely cut out the general practitioner from the medical landscape, and we were using the emergency room as our first line of medical defense. And where do people go in that situation? Especially when when you're locked down, you go online. And so I started doing my own research online. I couldn't even figure out the GI issues. And it took me to get to page 10 of Google Scholar to find one paper that showed that 4 people in Wuhan had diarrhea. I thought that I was so unlucky that I actually had a stomach bug on top of COVID. But while I was in isolation, I became completely obsessed with the idea of convalescent plasma. And that if I was going to emerge as one of the first survivors of COVID, and things were looking at that point to be positive, that I was going to make it through this thing, not end up hospitalized and come out on the other end, I wasn't going to be the first. I had no idea the number that would follow. But I realized that I would come out of this, I would emerge from this virus with this internal hazmat suit going on in my body that I was able to not give away, but share, not in a zero-sum sort of way, but I was able to share my plasma that had these life-saving antibodies in it. And I could volunteer to be studied. I could volunteer for every medical and scientific trial or study, anything I qualified for. That so many of the mysteries to this novel virus lay in the bodies of survivors like me. And so I started Survivor Corps on March 24th, 2020, not as a patient advocacy group, because at the time there was truly no patient advocacy to be done. You either lived or you died. But if you survived, you had the potential to save lives by donating your plasma, by participating in science. And so that was the mission with which I started Survivor Corps in those early days. And we were the first COVID movement to exist. And we are the largest that exists. And we became a patient advocacy group very soon. Within a matter of weeks, we realized that so many of our members were surviving COVID, but they were far from recovering. And they needed help. And no one was paying attention because the world was on fire with acute COVID. I don't even like calling it acute COVID because for so many people, the acute stage happens weeks in, months in. Long-term COVID can come from the most mild case. They can come from asymptomatic cases. As Dr. Lambert will explain in her studies, one of the things that we looked at was, was there one symptom that was most predictive of having long COVID? Could we tie it to the encephalitis? Could we tie it to the headaches? Could we tie it to anything? And the symptom that maddeningly came up as being most predictive was being asymptomatic. And so we realized that we had a number of fights ahead of us. One was we had policy fights. We needed to make sure that long-term COVID care was available to those who had not tested positive in the beginning. I was extremely unusual in that I was able to get not only a test, but a working test in March of 2020. Most of those first waivers were denied testing. And those are things that we still need to keep in mind, that we are not creating disadvantaged groups without realizing, in the same way that we went to the CDC this past late May and said, look, we're seeing a lot of post-vaccination infections, and some of them are leading to long COVID. Again, with terminology, I don't like the term breakthrough because it makes it seem rare. And it's not that rare. And we got them to change their guidance to say that if you are symptomatic, you need to get tested, because we explained that we are creating yet another disadvantaged class. Again, we are making the same mistakes that we made 18 months ago. And we got the CDC to change the rules and say that you can be diagnosed with long COVID without ever having had a positive COVID test or an antibody test. Now, that said, COVID CDC guidance is nice, but that doesn't mean that all of these institutions are actually following those rules. And we're going to have to deal with the healthcare system to create a landing pad in the healthcare system that is not going to break patients and is not going to break the system. You can hear from Liza's story, the number of doctors who she's had to go to, and the number of doctors I had to go to with a far more mild case. The number of scans I underwent, and the fact that nobody spoke with one another. And the part that I want to really focus on for a moment before I turn things over to Dr. Lambert is what we have done in the scientific world in the last year. And that is truly what I am most proud of. We have taken what was always thought to be traditional citizen science and reestablished it as citizen scientist collaboration. And what I mean by that is we're able to take real world evidence based on the experiences of our 180,000 members over the last year and a half and use that and look for signals. What are the symptoms, not what are the symptoms that are most frequently complained of, but what are the symptoms that are causing the most human suffering and the most human grief? What are the symptoms that are keeping people from going back to work? What are the symptoms that are causing people to have suicide ideation? These are the things that we need to triage in our research because we need to save, there are too many people out there who are suffering. And COVID has taken not just their lives, but their livelihoods. And it affects an entire family. If you take one person out of the workforce, someone else needs to replace that person. And if that person then becomes the caretaker to the sick person, and what if there's a special needs child involved who is relying on a parent's strength to be able to carry them up and down stairs, and that parent can't do it anymore? Long COVID is insidious. It is yet to have an acceptable definition. The WHO's definition is so broad that you could drive a Mack truck through it, and I think it ends up just creating more skepticism than anything else. But we are doing work with Yale University, with the Mayo Clinic. Dr. Lambert's research is, as you will see, is just breathtaking, and in the way that it also respects patient voices and puts patient voices at the center of the story. And we're able to take that real world evidence and go to the scientific and medical community and say, look, these Parkinsonian tremors, no one is talking about them. These feelings of inner vibration that are keeping people from sleeping at night, the extreme peripheral neuralgia that is reminiscent of advanced diabetes. How do we help people in the interim as well? How do we create inpatient centers for sleep and pain management to get people through until we have real answers? I'll tell you the quick story about this study that we had been working on recently as an example of the citizen scientist collaboration. Dr. Akiko Iwasaki from Yale in February floated an idea on Twitter that, so what are the biological mechanisms behind long COVID? What are the physiological explanations? Is it a viral persistence? Are there viral pockets still hanging out somewhere in the body? Is it an overresponse, an unregulated overresponse of the immune system? Is it latent viruses reemerging? What is going on? How do we figure out the path of destruction so we can find a route of remedy? And then I heard Dr. Griffin from Columbia Presbyterian, he chimed in and said, well, you know what? I've actually seen some of my patients feel better after the vaccine. We had been anticipating everything that could go wrong with the vaccine for long haulers because long haulers were not a cohort for the trial. And we were deeply, deeply concerned about everything that could go wrong. The one thing we had not anticipated is that people could feel better. And, so we were able to quickly do a poll of about 2,500 people over the course of a couple of days. And we found that 45% of our membership were feeling better after the vaccine. I will add 14% felt worse, and the rest remained the same. And we were able to take that data within days to Dr. Iwasaki and start a joint Survivor Corps Yale study where we recruited long COVID patients who had not yet been vaccinated. And Dr. Iwasaki and her team at Yale did autoantibody assays on them before getting the vaccine, right afterwards, at 6 weeks, at 12 weeks. And we're recruiting by April. And that study, that longitudinal study, is finished. And we are just waiting for her and her team to write up the study and get it on the preprint server. That is science happening literally at warp speed. And we need to continue that pace and continue doing it in a way where it also remains a 360-degree educational feedback loop. And people now know that we can fill up their cohorts, which is great. And we have academic institutions coming to us, private companies, pharma companies wanting us to fill their cohorts, and we are here willing and ready to do it. And because we can make things go faster, so long as things are done in the way that we approve of. Things have to be, every study needs to be built on a basis of equity, of transparency, of respect. What are the patients getting out of this? How are they going to learn more about their own condition? How will the results be disseminated? How will the data be protected? These are all the questions that we ask before we engage with any study. And it's keeping to that sort of ethical line. So the next, Dr. Lambert is going to speak next. And Dr. Lambert joined our team.
Actually, we heard
Nope.
from Dr. Lambert.
Okay.
We did, yeah.
I take that back.
Yeah. Yeah. So thank you, Diana, so much, and for all of you for sharing your stories and for sharing the research. We're not going to go to Q&A. We have a number of questions in the chat, if that's all right. And one of the things that would be really important to understand, and was a question for Liza in terms of how did you find a doctor that could treat you, and then so Liza first, and then we'd also like to understand how advocates and patients who are trying to find doctors who treat long COVID, do they go to your website? Do they go to your Facebook page? Do you have some way to find doctors or services? So maybe Liza first.
For me, I honestly, I got a little lucky because my now primary just felt like she fell into my lap because of being in the rehab hospital. And I think my case just kind of hit her heart spot. And so she took an interest into it. And then she had a connection with the doctor who started the first post-COVID clinic in the state of Texas. So that's how I got lucky. But then I've advocated and then shared that that knowledge with other people. For anybody else who's currently looking, go online, go to Survivor Corps. They have a wonderful list of all of the post-COVID clinics, and there's even a list underneath there where everybody who's been dealing with this and in their journeys now puts the information of any medical providers that they feel that are like knowledgeable and empathetic in the COVID journeys into a database. And so you can seek that information there also.
So it's easy to figure out how to find places in your area. That's great. That's amazing.
So I would
Diane.
just add, our website is survivorcorps.com, CORPS, and the most visited page on it is our list of post-COVID care centers around the country. And so far as I know, it's the only comprehensive list. But do go through them, and if you're choosing between them, be choosy. If it looks like it's all based on virtual visits, then it might mean that it's more about the institution gaining data than you getting services. A lot of these programs are also repurposed post-ICU treatment centers and are better served. They're more focused on pulmonary issues and people who are coming off of a ventilator. So that's also something to keep in mind as you're looking through, if you're lucky enough to be in a place where you have multiple choices.
It's interesting. I wonder if we have a community of advocates that actually may specialize in the future with long COVID patients, because it seems like there's such a unique collection of symptoms and things to steer between, getting into rehab to getting your insurance covered and everything. Liza, your story was just really amazing, and yours too, Diana. And thank you, both of you, for contributing so much to what we will understand about this disease. We have one question, and we have many questions in the chat, but one question for Dr. Lambert. Is there any increased incidence of heart attacks post-COVID, specifically spontaneous coronary artery dissection in people with no known CV risk factors? This person is aware of 2 middle-aged women with chest pain 2 to 3 months post-breakthrough COVID infection.
It's a really fantastic question, and that's research that there are different teams that are looking into. We don't have a certain answer yet, but we do know that long COVID causes many impacts to the circulatory system, and we know people experience things like heart palpitations, irregular heartbeat, racing heart, all of those things. And we know it can also cause a lot of clotting problems. So the question really is, what are the long-term impacts of that? We know short-term what those symptoms look like for long COVID, but long-term, does that mean that someone will be at greater risk of things like heart attack? And it's very possible, but we need to continue the research to really understand that. I think that if you have long COVID, I think this comes back to an advocacy point here, where I think you should make sure you're going to your doctor and you're getting checked out, especially for different symptoms you've had. But if you feel like you were at risk for different heart problems before, go in regularly and get checked out. I just don't think that we can wait for doctors to build that into the care program for long haulers. We need to be going regularly and getting things checked out, because it's very likely that there could be long-term damage.
So do you think in the future there'll be some kind of, sorry.
If I can just add to that, actually JAMA Cardiology published yesterday. It's a small study, only 100 people, but pretty powerful results. 78% had cardiac. From JAMA Cardiology, of 100 patients who had COVID-19, 78% had cardiac involvement, as shown on cardiac MRIs. 2 to 3 months after having COVID-19, 60% of those patients still had cardiac inflammation.
Wow. So, and I know all this data is emerging, but I'm kind of curious what you all think that in the future, COVID long haul will be some kind of screening tool of some kind. Especially, I think one of the scariest things about this disease is that asymptomatic COVID can lead to long COVID on all these collection of symptoms, including, anxiety and mental health problems that might just be kind of underlying, might be misdiagnosed as not having to do with this. So do you think in the future there will be some kind of screening tool so people will understand if they might have been at risk for long COVID?
I think
we were very much hoping that the test was going to be just that. In fact, we helped Adaptive Biotechnologies develop the first T-cell test for COVID, in the hope that that would be sort of that, magic way of discovering who had and who hadn't. And of course, as ironies go, further study has shown that long COVID can actually disrupt the regulation of T cells. So right now, we do not have a screening tool. I just moved cities and just went to a new GP yesterday morning, and the doctor did not ask me whether or not I had had COVID, did not ask me what I brought it up, Didn't ask me if was having any long-term effects or anything about it. And that was
Wow.
from a pretty major medical system, in a major city. That was shocking to me. I think that until we have a technical way of screening for it, it needs to be part of every medical intake. Not just have you had COVID, but here's a list of 40 symptoms. Have any of 100 symptoms, and if you tick off more than 10 of them or 5 of them that are new and unusual, then you need to suspect that there might be COVID at play.
So is that something that your organization will continue to be working on in terms of screening tools and basically aggregating and helping to educate doctors and medical professionals about how to spot long COVID?
Absolutely. I think that, our Facebook group of 180,000 people is, some of the smartest doctors I know are members. It's an open group because if you put in a keyword search on a symptom and no one else has experienced it, it's probably not related to COVID. But, I've read articles online. I was really pleased. I mean, not pleased. It's hard to be pleased about any of this, but, I read an article not that long ago by a doctor in England who was presented with a patient with extreme peripheral neuralgia, and the patient suspected that he had COVID, but was not able to have gotten tested. And the doctor said, "Well, I can't understand how there could be any correlation between COVID and peripheral neuropathy." And he went on to Survivor Corps and looked it up. And lo and behold, so many of our members are suffering from extreme versions of this. And he was able to put it together that they were connected and that's what was going on with this patient. And he had COVID and his other symptoms matched up as well. And so if you're a clinician, I highly recommend, and even if you haven't had COVID, I recommend joining. It is the strongest reason to not get COVID is because that is the only way to avoid long COVID. There were so many of us who got it in the beginning who had no control whatsoever, and there's still people who get it beyond their control. But it will make you take every extra precaution in order to avoid.
So thank you so much, Diana Barrett, survivor and founder of Survivor Corps, Dr. Natalie Lambert, and Liza Fisher. And I know, Liza, you've been on the HUVA app, and I know that people will take you up on your offer to talk about your billing, insurance, and navigating your symptoms as well. So I hope you'll be able to answer some questions through the app. We're done with our session, the first session of the day, and we'll be meeting you in about 15 minutes. So thank you all so much. Really appreciate it. And learned a lot, and more to come, right? Thank you.